Welcome to Women Building Women, the podcast with the intent of driving out animosity amongst women. I am your host, Samantha Litedi, and this episode is titled Healing Hands, Heavy Hearts. I want to take you guys on a journey of the reason that I have PTSD when it comes to nurses. So I was in primary school and I had diarrhea. And it was one of those cases where you have it for like a couple of days to the point where you start getting cramps. So I went to the nearest clinic, mind you, at the time, don't have money, had to walk there. I don't even know how I managed to do that. I get to the clinic, I explain to the nurses what's happening with me, and they tell me that they are dealing with far more serious situations and they dismissed me. So I left. Fast forward to, I think around my early 20s, if not mid 20s. And I go to a clinic in Midrand. I had to get my contraceptives, Trifacil. So I had actually just moved to Midrand. So because of that transition, at some point I bought Trifacil for myself. So I didn't use my clinical card where they record, that your next date when you're due for the next set of pills. So I get to the clinic, I try to explain to the nurse. And mind you, also at the time, I'm using my lunch break, right? And I'm just there to collect pills. So I'm like, this is going to be a fairly easy process. But I had to wait. I waited for so long. I think even my lunch break was already over at that time because they were putting the moms and the babies through, which I understood, fair, even though, you could have handed me the pills and I could leave, but okay, that's fine. So I get in, I explain the situation about when I moved and the reason that the records are not up to date on my card. And her response to me was, "Libizila khosha fantlef. Ge fetsa le tla fo tleliniking le batla dipilisi tsa rona gore le bolae bana. Tsamaya go reka pregnancy test o tlo testa gore bone gore a re go fe dipilisi gore o bolae ngwana." I left that clinic. I went to my car. I don't even think I went to go buy the pregnancy test. I sat in my car for a few seconds, just like catching my breath. And I was really hurt. I'm such a softie, guys. Yo, pelaka inyani. And even though, thinking about it now, I know that that lady doesn't know me. So whatever she said about me can't even stick. And it's not valid because you don't know me. But at that point in time, I was crushed. And I was like to myself, you know what? I'm going to just maybe buy the pills at like a Discam or a Clicks going forward. I'm not going to go through this whole clinic process, which obviously is much cheaper because I get 3 packets for free. Whereas if I go to like a Discam, for instance, I have to buy 1 packet every month. But then luckily, I don't even know if I'm allowed to mention this, that you were there at Discam, that you worked at Discam, but I think it was Baby, what's it called? City. Yes, Baby City. Yes. I went there, and then obviously I found you, my guest, Zodwa, and I'll get to your introduction shortly. And the way she just assisted me, and she was friendly, and we were vibing, and there was just this energy and aura about her that was so beautiful. It just turned everything around. Like this view that I had of nurses completely changed because of her beautiful heart. So I'm so grateful that, we got to cross paths because now we're at a point where I believe we are developing a friendship as well. So something really beautiful came out of this. And I thought to myself, you know what? Maybe it's about time we speak about the nurses who are, I don't know how to put this in a politically correct manner, but nurses who are less friendlier to us. And maybe if we speak to somebody who has been in that space, they can shed some light. So my guest, Zodwa Banda, is a registered nurse and clinical health practitioner, and she goes over and beyond in supporting her patients. She did it with me. So, she is really compassionate and I believe leads with empathy in her work.
Oh, thank you so much.
And thank you for joining me.
Thank you so much for having me. Thank you so much for having me. So, hi everyone. My name is Sister Paula Zodwa Banda. I'm a registered nurse, as she's already introduced me. Thank you, my lady. So I'm also a founder of a clinic. As she said, I had previously worked for Discount Baby City, which was a great experience, but we're not for that today. And I currently run my own clinic now, which is called Cuddle Care Mother and Baby. And just a small disclaimer before we start, because we're dealing with legalities such as the South African Nursing Council and the Department of Health. Whatever is going to be said here, purely my opinion, not the view of the Department of Health, the clinic I work at, or any legalities affiliated with my work.
There seems to be a lack of patience when it comes to patients. See what I did there?
I said.
So what would you say is the reason for this? Would you say it's because like nursing is demanding, the healthcare environment is stressful? Like what are the factors that you think result in that?
I'd first like to commend you for asking that question or posing it in that manner after having been treated so ill by nurses, but yet you pose your question so respectfully. So we appreciate that. So nursing in South Africa in reality is that we have no resources, if I should put it like that. Not that we have it, but we have a great lack of resources. And that is why we find it one person doing the work of 3 or more persons with the resources only meant for one person, unfortunately. And of course, with that, there's long working hours, there is a chronic staff shortage, there's patient overload. And obviously with that, we are going to experience physical and emotional fatigue, personal and emotional detachment. And where you don't have support, compassion is going to be harder. Not entirely impossible, but it's going to be harder. And as I always say, in nursing, in a profession, you choose compassion and empathy every day. It is not a personality trait. You choose it every day, finding yourself in such a noble profession. So yes, definitely long hours, demanding patients, not demanding in a way that verbally they want this and that, because the sickly, they're ill, they need certain resources to be taken care of. Food needs to come at a certain time, and that is never really a timeless thing, especially in the public sector where there is a lot of patients or there's a patient overload.
So how do you manage to continue to lead with empathy even in those spaces?
So I kind of dislike it sometimes. I'll start there when people say nursing is a calling. By all means, it is not. You choose to be nursing. I wanted to be a tech girly. Like, I'm very inspired about technology and all these software engineers. That is the direction I've always wanted to go. But because of certain things that we're not going to talk about today, I found myself in nursing. Immediately fell in love with just helping people and being there with people and walking with people on roads that they never think they can actually walk alone, So that is how I think I developed the compassion. I developed the empathy for that. And like I said, not a personality trait. I wake up every day and think it could be my mom, it could be my dad, it could be my grandmother that is needing help. And I am holding back that care, that compassion. Remember, the more compassionate you are, the more empathetic you are, the more a person will open up to you. And you find that in most times, a person is not physically ill, but emotionally ill, psychologically. They need that attention. Therefore, the more you pay attention and the more you show that you are open, they're definitely going to open to you. And that makes your work easy as well, because then diagnosis is better. If you cannot help them at your level of care, you can always use the referral route and transfer to a higher level of care.
I think I agree with everything you're saying, but I beg to differ with the personality trait. Yes. I believe that it is a personality trait. I don't think I can wake up every day and practice kindness. Yes, maybe at the face of it, I may seem kind, but internally in my heart, that's not what's within. And I think in as much as you we're not passionate about this
Yeah.
field.
Yes,
But because
yes.
of the heart that you have, it's so much easier to be empathetic.
Mm-hmm.
Whereas
Mm-hmm.
maybe there are people similar to you as well in nursing, and it's not necessarily just the whole part of constraints, like lack of resources, but you also find that they're within nursing because they had no other option.
Yes.
So they're not passionate about it. And now they have to deal with people every day, and they also don't have the emotional intelligence, or that's
very
just
important.
not the heart that they have.
Very, very important. So if you put it that way, definitely that makes sense for me as well. And touching on emotional intelligence, I mean, for example, if you're working with heavy material, we're not going to choose the smallest guy. We want a guy with big muscles. So you must work out so that you are able to handle big or operate big machinery. So as a nurse in your profession, what is so difficult about saying this kind of work needs compassion? It needs patience. It needs empathy. Because even when I'm ill, I want someone to be more patient with me, because I'm not only in the, feeling ill, but I'm also not in the correct state of mind because I'm not feeling well.
Yeah.
Yeah.
That's true. And I think later on, we're going to dive into the more solution-driven types of questions. So I've noted everything that you're saying. Another thing that I find is it seems like there's also animosity that exists amongst nurses themselves. And I say this because, so then rewind back to the story about the Midrand clinic. So eventually I was like, let me suck it up. I don't have money for these pills every month. Let me go buy that pregnancy test, go back to the clinic. But this was a different day. That day I was too emotional to continue with that.
Understandable.
I just went back to work.
Yes.
So cool, it's a different day, buy a pregnancy test, go back to the exact same clinic, because that's the closest clinic. Like there's no other way. If I'm going to even open a new file, it has to continue there. So I go there, I find this other nurse. I think her surname is Batista, which was wild to me. I'm like, what? Okay, Batista was my favorite when I used to watch WWE Raw versus SmackDown.
Yes.
So she's like, Sister Batista. I'm like, okay. So I get in there, ke pregnancy test ke ready go irwa test. Ka mo tlhalosetsa ka re ene ke le fa maloba eng batho ba ba lapisa wa itse na re bantsa tla ke go fe dipilisi bathong. And then ra simolla ra tlotla fo. But I could also just gauge that some of the nurses there didn't really like her.
Yes.
Because she was friendlier to patients.
Yes.
So I'm trying to understand, how does it come about, like in terms of animosity with nurses themselves? Do you have an idea why nurses are hating on each other?
So one of the most, or one of the main contributory factors is the nurses that have been there for quite some time. The older nurses. And by all means, these are the nurses that have a wealth of knowledge. They're great, they're experienced, they've been there for umpteen years. And then comes the younger nurses. Okay, so we newly qualified, and obviously we bring in more energy and we bring in different knowledge, because remember, nursing is a science. So it's researched every now and again to improve patient care. They are stuck in their old ways. They are stuck in that old culture, I'll call it, of and we even name them, we used to name them that. And it's not just against nurses only, even with other healthcare professionals, doctors, physiotherapists, they tell them where to get off. And not thinking that they still have that knowledge of 20 years ago, and times change, and with times we must move forward. And then it's very difficult to have a gap or a bridge between that animosity, because even with the management, in nursing, for you to proceed or to have a promotion, especially in the public sector, you get promoted because of your experience, not because of your qualifications, which is quite wrong, because we've got qualified nurses out there who specialized, who've got beautiful degrees and are knowledgeable, but are still managed by someone with a 2 or 3 year diploma, simply because they have experience. And then the solution to that, I bet someone out there has a better answer than myself, because it's something that's chronic, it's been ongoing. So we don't know if there'll ever be a solution to that.
And you know that exists even in corporate. Or we're no mang little girl who just arrived. That mentality. They don't have a forward-looking improvement type of mindset. It's just stuck in their old ways.
Yes. And imagine if the young and the old were to collaborate their knowledge. Imagine the experience, the expertise that one will come to make things better in the working place. But because people are people and we can't change them, it is what it is.
This is such a sad reality,
It is very sad. It is very sad.
I remember when we were in varsity, so there's a friend of mine who got pregnant. What year were we in? I think we were in our 3rd year of university, which at that time, our parents back in the days were having babies at 21. Come on, I know times have changed, but it's reasonable, I guess. It's not like teenage
You're
pregnancy.
Not a child anymore.
Exactly.
Yes, you're not a child anymore.
And she was like, I remember a few months after the baby was born and stuff, she was like, Sam, we get a favor, moske ngwana. Go clinicing, go spetlele ne ba ntlapa gore di nurse tsele ba ntlapa ba bula maoto a ke re gane ba go ja fa no parallels maro pallwa ke go ntsha ngwana ya no things like that. You see, even things like that, I'm just like, yo, guys, it's somebody messy.
But banana, it's pineapple. That is a very famous phrase in the maternity wards, especially in the public sectors. And actually, that is what drove me out of the public sector as well. I'm absolutely passionate about midwifery and female reproductive health, but I had a case so big that I was left alone by advanced midwives and something happened to a patient that I could not get over. So I decided that I really love this, but this is not how I want to work. This is not how I want to take care of women. So I left because of that.
Yeah, so many women feel judged in terms of their sexual health, their lifestyle. When you think about going to the clinic, about certain aspects, even weight, there's so much judgment. So how would you advise your fellow nurses to treat those women who come in and, there's certain factors about their lifestyle, which maybe they need to change or whatever the case may be, but how would you advise them on how to treat these patients?
Women are carrying a lot. Women carry a lot that they don't talk about because, you said, the animosity between women as well.
Yeah.
And they have no one to vent to. They have no one to talk to. If someone comes to the clinic, they're already hurt. They are looking for assistance. And as you say, because of our attitude, it is already hard because you're thinking of the judgment. You're thinking of whatever nasty things that are going to be said to you. So what I normally do and what I'd advise nurses to do, when a woman comes in, straight face, a smile, firstly welcome them because you do not know what this woman is carrying.
Yeah.
As she sits down, you note her posture. That is how nursing should work. Physical, what's the right word? Even when someone is not talking, you can just note
body language.
Body language, that's the
yeah.
correct word.
Yeah.
Body language says a lot. And also just the way they carry themselves. You can even start diagnosing from there. As she sits, the first minute you want to listen. Simply listen, no judgment, no talking on top of her or asking questions. Listen and validate her feelings more than anything. If she says, I've had a headache for 3 weeks, for example, because I know then we start pulling her face. 3 weeks and you're only coming today, that's the first thing that comes to your mind.
That's why it's
I've had a headache for 3 days and I've been coughing blood and there are no necessary and things like that. So you really just want to say, even if you know at the back of your mind you're questioning it, you're not going to say anything to the patient until you get the full story. And you are going to validate her by saying or repeating what she's saying. So you say you've had a headache for 3 weeks. What have you done? Have you had medication that didn't work? Where is the headache located? Such questions encourage the patient to be more open. So instead of just judging and looking at a person at face value and thinking, oh, hi, this one probably just wants a tramadol to be high or to sleep better, because that is always the thing, you know. So an open, non-judgmental, safe environment is going to make sure that your patient is open to you and trust you.
And you're able to help them better, because then you get to find out exactly what's wrong with them. If there's just judgment from the first line, like how exactly
you are going to withhold a lot of things, because if you're talking about a headache and then maybe there is an issue with your reproductive system, maybe an STI, you are going to keep quiet. You are not going to expose that, because if she's judging me about such a small thing, what about if I start talking about my sexuality, which is a very private, a very intimate and sensitive topic to talk about.
That's a good one. That is a good one. So like care around miscarriages, abortion, or reproductive health, like health, like you said, can be very sensitive, right? So what does professional, non-judgmental care look like, even when your personal beliefs differ? Because I believe, like, with a lot of us as Black people, speaking for Black people now, but I think a lot of us are Christians, and I don't think we believe in terminating pregnancies. And obviously, this happens. This is real life.
It's reality, everyday life, definitely.
Exactly. And I think that's maybe one of the main things that nurses would judge other women about, right? So what does professional, like non-judgmental care look like?
So first of all, in South Africa, nurses have a pledge. Okay. And one of the contents in the pledge is that you will not allow your belief or your race or your religion to stand between you and your client. So we put that aside, and it further says the total health of my patient becomes my first consideration. So right there, we're not thinking about you, and I just want to remind nurses about that pledge that we took solemnly.
Thank you for reminding them. I think a lot of them need that reminder.
So from that only, you agreed that when you nurse a patient, you are not a Christian. You don't practice spirituality. You don't attach any religion. You don't attach any belief. This is a patient that needs help. And I always say that if you feel that by you helping the client, you are going to cause harm, because remember now, if you lack compassion for whatever the person is bringing to you, and you feel you are going to be judgmental because you have a certain belief, refer. That is why we have a referral system. And not being rude. Rather tell the client that I don't offer this service. Please go to this clinic, and you can go a step further. It does not hurt anyone to take a phone and call a sister nearby. We have each other's phone numbers in clinics, and book an appointment for the client, so that the patient does not feel like you are showing them away. Because if you are referring me somewhere, you know, I can still go and get the help that I need. And further, we are also guided by the choice of termination of pregnancy now in the professional context, that clearly states that when a girl of 12 years and above comes for a termination of pregnancy, provided that she's within the weeks in a primary healthcare, that's a clinic, that the abortion can be performed at the clinic, you are not even going to ask her questions. You are going to give her knowledge, you are going to educate her and help her with a decision, not make the decision for her. Explain the procedure, what it's going to look like. And you know, before you approach, you really want to say to the person, I am going to do a blood pressure check, for example. Because you know, with termination of pregnancy, you never really know. It could be incest, it could be rape, it could be sexual assault, and the person is not really ready to talk about it yet. And you want to give them that space. So you're going to approach with ease. I'm going to touch you. I'm going to do a blood pressure on you. I'm going to do maybe a vaginal examination for whatever reason, so that the person is comfortable and they know what you're approaching with. Yes. So no questions. You give informed consent, so that knowledge, so that the person can make informed consent.
Yeah. I wish we all knew this. Because I'd be there like, hey, close your big mouth, Mrs. Nurse. I'm kidding. I wouldn't say that. You said you moved out of the public space because I guess there were certain things that happened and you're like,
Yes.
I don't have the thick skin for this. Do you mind sharing some examples of scenarios, whatever happened
Okay,
during
so
that time?
the most recent one that had happened before I moved to the pharmaceutical company, I was working in a maternity obstetric unit. And as we had 3 other midwives and then myself. I was the junior midwife then, but qualified. Had graduated and everything at the time. A complete sister, I'd call myself then.
Oh, yes.
But from day one, nekibitswa ngwana skolo, you know, no one was interested in Paula, Zodwa, nekile ngwana skolo. So much that I was even delegated the duties of the nursing assistants. Whilst they were sent to buy amagwinya and whatnot, I'd do all those duties. And when the women came in, it was my duty to admit, to take vital signs, to progress them. Sometimes I'd be having 4 or 5 women that I'm progressing at the same time in labor. Yes.
One man.
By the time
One
I knock
woman
off,
in this case.
And you know, sometimes when you're young, you don't even really read about your scope of practice and understand what is expected of you as a junior nurse as compared to people with specialities or advanced midwives as compared to then. I was just a junior midwife, newly qualified. So come this woman, she was from Zimbabwe. I will never forget that woman. She comes and no maternity case record. So a maternity case record is the book that you are issued at the clinic when you come for your first antenatal care. So it's got all the information that will be needed in case something happened to you or when you go to deliver. That's where we record everything. So not booked, never attended antenatal care. And so I start taking history. And this woman says it is her 4th child. So in a maternity obstetric unit, it's still safe to deliver her there. It's only when it's now the 5th pregnancy and up, because you get women like that, isn't it? Then you refer to the hospital. So I'm sitting with her, I'm taking history as per normal.
Yeah.
And you know when God wants to protect you, and like you said, when God knows your heart, something in me just say that, put up a drip on this woman. I do not know why or where that came from, and I put up a drip on this particular woman. And as she said there, I was like, but I used a smaller needle. Let me put up another drip on the other arm. Very awkward, as I have other women that I am progressing in other cubicles. So I do her history, and I'm telling you, it was less than 10 minutes. And the woman started screaming, and she was ready to push. I had not yet done a pervaginal examination. I was still preparing for that. So when I opened, I could see the head on the perineum.
Oh my gosh.
So I quickly put on my gloves. Luckily, there was already a delivery pack there. So as I started asking her to push, you know, the baby just came out, slid through. And I'm like, oh, very easy delivery. But you know, you start thinking as well that, okay, it is the 4th pregnancy, all right. But when I'm about to give her, there's something that we call syntocin that makes the uterus contract so that the placenta may be expelled. As I'm about to inject her, this woman starts bleeding. She bleeds profusely as if there were taps that were open. So I run and I call the sisters, and they say they are on their way. They are sitting there, they are having their lunch. Take care of the baby, move the baby to the neonatal unit. So I take care of her. One comes and she gives me instructions that, okay, do this. I am going to be calling the ambulance so long because this bleeding is abnormal. It is way too much. It's probably she drank something, or maybe her uterus is just failing to contract. So I sit with this lady now and I start asking her questions as I'm managing her, you know, trying to spill out the clots, rub her uterus. And now we've given her all the drugs that are needed to try and stop the bleeding, right? And then you know what she says? She says, actually, sister, this is my 8th pregnancy. This is my 8th baby.
And why did she lie?
And Kanakwe, I am so frustrated because, I'm a student and I have never had a case like that. I've seen it happen in hospitals where I trained your Baras and your Leradongs, And I'm like, but why didn't you say so that we could help you better? Because we don't have the resources to assist you in this unit. And she's like, but you guys. And it's like, but you guys. And me, as a foreigner, as someone who comes from outside, undocumented, and then I choose to just leave that and I continue assisting her. As I moved the baby, I handed the baby to one of the sisters. The baby was left there unattended, right? So now, coming back to this woman, she has bled. She's paper white. We are waiting for the ambulance. And I say, you know what? Maybe if I bring her baby to her, because I remembered that I did not have time to show her the baby. Maybe it will motivate her. Just keep her alive. Maybe 30 minutes longer because the ambulance is on its way. The doctors at Bara are equipped. They know what to do with her. I tell her that I'll be back. I am going to fetch the baby. And I was not a big believer in spirituality and things, especially in African spirituality. This woman says, no, my baby is with my grandfather. And I say to her, where is your grandfather? And I'm thinking she's starting to be confused because when you lose that much blood.
Yeah.
Yes, definitely. And she says, no, they're sitting right here with my grandfather. They are waiting for me. Bang mele. I'm like, no, this one is getting confused. So let me just quickly go and get the baby. I go into the cubicle. And when I get there, I still get chills. And I still get, I don't know, emotional over the situation. I get there and this baby is ice cold.
You're going to make me cry.
Sorry. This baby is gone, right? And I'm trying to figure out that, did I not clamp the cord properly? Or what could I have done to the baby? So it does happen. But I mean, if there was someone that was attending to that baby could have been alive. So now I must go to that mom and tell her that her baby is no more. Samantha, I get to the cubicle. It was as if I had left for 30 minutes or more. She was gone. She was gone. That was the first time I cried. I cried as a professional. I cried that day and I just couldn't take it anymore. I'm so sorry.
Just like,
I'm so sorry.
that it hit me so hard. I should have brought my tissue. Now I'm a mess.
So the most shocking thing for me thereafter was when I actually went to report to the sisters, to the seniors, that the mom had passed. I got, death is the inevitable. I mean, we all know that death is the inevitable.
Yeah.
And maybe we couldn't have prevented it. But if we worked in a team, we could have had a better outcome, especially for the baby. I believe with all that I have, that the baby would have been alive today if we followed protocol, if we worked in a team. By the time the ambulance arrived, there was no baby to hand over. There was no mom to hand over because both were gone. And I decided from that day onwards, yes, the SANC got involved, the Department of Health, and proper disciplinary measures were put in place. But I decided from there that I am not doing this to myself. I am a big advocate for women's reproductive health. As I said, midwifery for me is a passion. I live it every day. If things were different, I'd still be in a maternity ward helping or assisting women give life. It is the most beautiful thing. It is the purest thing to just assist in giving a new life and assist getting a new life into the world. But I could never do that again.
I wish there were
I could
thousands
never
of
do
you
that
in
again.
those spaces. Because also the fact that you already had, you said 4 other women as well.
Yes, that I was already progressing. That way in labor.
And other nurses are seated and it's all good and well. Oh, let the junior do it. Like, we're talking about people's lives. You're talking about children's lives, babies' lives.
Yes.
But they're just nonchalant about it.
And it happens everywhere. It happens everywhere. If you go on social media, a lot of nurses, young nurses, are leaving nursing. Or if they're not leaving nursing, they're going overseas for better opportunities, for better work environment. Even if it's not for the money, definitely, because your mental health should come first at the end of the day.
I can imagine.
It should be a priority at the end of the day.
I can imagine the trauma coming out of that incident, like how you felt.
Very traumatic. Very traumatic.
But how are we going to change this? Because the good people, you guys and the other young nurses are leaving because you can't handle this, but your hearts are in the right places because you want to help. And then those who are nonchalant are the ones that are just sitting there unbothered while we're losing lives. Like, in as much as, yes, there was disciplinary action, Department of Health came in, but what are they doing going forward? Do you know? Can you maybe advise on your side? What would you tell someone from the Department of Health to start doing in these different public hospitals or clinics so that this doesn't come about again?
I think this kind of situations happen every day, unfortunately, in hospital setups where there's a patient overload and there's shortage, like impossible patient-nurse ratios. Unfortunately, it's a thing that happens almost every day. We see it. So as much as the Department of Health, they do have strategies and things in place, but also because of the shortage, for example, in a hospital like Bara, when one midwife leaves, the hospital feels it because it's not easy to replace nurses anymore. It is not easy. Yes, the posts are available on paper, but there's no budget for it. So
this is so disappointing.
It is disappointing and very sad. Yeah, it's very sad. It's very sad. Nurses are expected to work in very demanding, very impossible situations. And as a result,
Exactly.
But however, it still does not excuse harm to a patient, whether physically or verbally. It will never excuse harm to a patient because that is not what we are there for.
I think I need a contact from the department. I think I need a follow-up of this episode and interview someone from the Department of Health. Honestly, girl, if you have any contacts, please, because there needs to be a solution,
There definitely needs to be a solution. I think both we and the patients are being failed by the system tremendously.
And the system is a bigger problem.
The system is a bigger problem. And unfortunately, then we take out our frustrations on the patients instead of the system. And if you want to challenge the system, by the use of marching in the streets, that is what was previously done. But then you're also contradicting your pledge. Because if you are in the street, who is nursing the patient? Then you are not putting the health of your patient first.
Damned if you do, damned if you don't.
And then you can be disciplined for that as well by the very same system. It is a punitive thing by the system.
We need to circle back to this. I don't like closing out my episodes without solutions. So it's really bugging me. And this is a huge problem. And I hope that at the time this episode is released, and I also publish the clips on TikTok.
Yes.
I hope this goes viral.
Yeah.
Because something needs to change.
Yeah.
Honestly, we can't continue like this in this country.
And not just in this country. I read an article yesterday by the World Health Organization that they are estimating that by 2030, it's literally 4 years down, the chronic shortage, it is a crisis, by the way, the chronic nurse shortage worldwide is going to be worse by 2030. So if we are going through these working conditions right now and patients are going through this behavior and attitude and ill treatment, what about when we get there? Let's just hope that in South Africa, we have different strategies in place.
How is it in the private space? Because obviously here there's a lot of emphasis on the public space.
Yes, yes.
How is it in the private space?
So I wouldn't say it is very different in the private space as far as staff shortage is concerned, but because we have a lot of nurses also from the public sector that want to do overtime by the use of agencies in the private sector, and also the unemployed nurses. Because there's a lot of them. There's thousands of unplaced, qualified, knowledgeable nurses because of the very post that is available on paper, but have no budget to fulfill it. So in that sense, most of these agencies then see that gap and close it by distributing them to the private hospitals.
I think all of you nurses who are hungry for this and want to help people need to join forces.
Definitely, we definitely need to start.
If it means you somehow start a private clinic of some sort, but I think coming together with the same goals, values, and mindset, you guys could actually achieve something great.
Definitely. And we're quite seeing that a lot, of which I'm happy about, that a lot of nurses are really going into their own private practices, and we're really hoping that whilst they practice the empathy and they practice the compassion, because you know what, you start your brand whilst you are still at your employer. If you're looking to open a clinic, you start there with the empathy and the compassion, because if I go out and I open a private practice and I'm that more, then what's the point?
Right.
What is the point? What is then stay where you are? So I'm really hoping that it's nurses like that who really just want to show care and put their clients first more than anything.
Before we dive into our final question, I want you to tell everyone exactly what you do at your clinic, because obviously, yes, you've opened your practice as well, which I was so proud. Guys, I'm such a crybaby. I got there and I was like,
she made me cry so much.
Gosh, you did that, girl. Like, I'm so proud of you. I'm so happy for you, because you were like, you know what? I really love this thing that I'm doing. Yes, it started out as not really being passionate about it, but I love changing people's lives. And the system is not working out, so I'm going to create something of my own and create a safe space for other women.
I appreciate those words.
I'm giving you the platform to advertise, girl.
Thank you for the free advertising. Okay, so what we basically do at the clinic is primary healthcare, everything that involves primary healthcare. So I'll start with my beautiful babies. That is what I love the most. I love my babies. My mommy's knows. So while baby vaccinations, as we all know, babies need to be vaccinated. There's a lot of diseases going out there. And I know that a lot of parents are misinformed about vaccines. So you get a lot of anti-vaccinators. We're not going to talk about that today. However, going forward, we also have baby consultations. If a baby is sick, you can see your baby. We have a doctor in-house that can give a prescription. Because, as nurses, we are not going to prescribe antibiotics. Our scope does not allow us, so it is the doctors. So if baby is sick and needs referral, we can also do that. Refer to a ped, refer to a higher level of care. And then obviously our well babies who are just there for milestones, growth and development. And then, of course, my favorite subject, reproductive health. Women reproductive health, to be specific. Yeah. So we offer a choice of termination of pregnancy. Basically, with the women, we have a gynae.
I was about to ask about that,
We have a gynecologist. A shame. He's brilliant. Love working with him. Very patient with the clients. Basically, me and him have the same compassionate, empathetic care, of which I love.
I'm switching gynaes.
And he's a female. And you don't... No, sorry, he's a male. And you don't really get that about male. Because everyone is like, no, I want a female gynae. But when they get there and they meet Dr. Rachabedi, it's an absolute blast. Aww. So if you want a tubal ligation, you're done with pregnancies, he can assist you.
I haven't started, but I'm done.
Come on now. I must still be an aunt, an official aunt. Don't do that to me. Don't rob me.
Sorry, continue.
So if a woman is struggling with fertility, a woman is struggling with hormonal balance, struggling with periods and painful periods, anything that has to do with gynecology, anything that has to do with reproduction, we are able to assist. Even if it's just a low libido, or you're just struggling to, have a good time in the bedroom with the dad, he can assist with that. Right? There are many ways, trust me. And then we manage chronic illnesses and ailments, including your human immune virus. We have pre-exposure prophylaxis, post-exposure prophylaxis, and we do the management itself, including your diabetes management, hypertension, and family planning, which is also part of the reproduction, especially with the teenagers. Absolutely love them. And I'm seeing a lot of them lately. You see, the more you open you are to these younger ones, you can advise them better.
Yes.
I'd rather start them on family planning at the age of 16 or 15 or 14. If they are having sexual intercourse, I am starting them on family planning. Because if you tell them, no, you are not supposed to be having, they are already having it.
Yep.
It's falling on deaf ears. So rather protect them, teach them about condoms. So that is what we do, just that counseling. It's one of my favorite things to do, just empowering young women so that as they grow, they want to have careers. You know what teenage years can do to you? Hormonal imbalances and stuff like that. And you don't really know what you're doing at the time.
Yeah.
But you want someone to walk that road with you and to ensure your safety. So yes, that's more or less it.
Oh, beautiful. You're such a powerhouse. I'm listening to all of these things. I thought you were just going to say, oh, yeah, we do family planning. And yay, you went in. I love it. Absolutely love it. And I know you're on the socials as well. Do you want to share your handles where people can find you?
Oh, yes, please. On TikTok, I am Sister Zodwa. Cuddle Care Clinic, and then I'm also on Instagram as Zodwa Banda. That goes for Facebook as well. Zodwa Banda.
Awesome. So finally, so for someone like myself, for instance, who's had like a very terrible experience with nurses,
yes.
How would you advise other nurses to handle people with that bad experience? Like within the first 5 minutes when they arrive at the clinic, what should they do differently that will make that person feel safe again within a clinic or hospital type of space?
So there's someone that said, a doctor actually, from a South African doctor, that actually said, within the first 7 seconds, a patient knows whether they are going to trust you or not, or whether you are going to ill-treat them or treat them with care. 7 seconds. And I mean, that's no time at all. So you really want to have that approach that, this is a safe space. First of all, introduce yourself. Have your full uniform on, because this is what distinguishes us. A person must know that you are not a bogus nurse. You are in the right hands. Introduce yourself so that they know who they're talking to. Sit with them, listen to them. Like I mentioned previously, sit with the intention of listening. And the more you're listening, the patient will see that, no, man, this person is involved and this person is invested in this consultation. Therefore, gaining trust in you and opening up more and more. And also validate the past pain. Because they tell us, our patients will tell us, sister, ole untreatile so. Sorry, man, sister. No, then you are worsening the trauma. You are deepening the trauma. Validate the past hurt and go on and say that, I do not know why she treated you the way she did. I am sorry. That is not the way you're supposed to be treated.
Yeah.
And you go on now. Unfortunately, at times we have to overcompromise. I know I do it a lot. Because some come very angry. They come. But because I have to come to you, you're a nurse. Sometimes I'll make an example. I had one mother that came to do the baby's vaccination. And this woman was just so thick, like you could not get through her, you could not penetrate her. And I was asking, how old is baby? Here's the card, was the response that I got. oh, mommy, okay, which vaccine? But you have the card, you know. Very dismissive and just not nice. So I started talking and playing with the baby, you know, noting the behavior. Vaccinated baby, explained side effects, you know, and then finally when we sat, I asked her, how was your day, mommy? And she cried. And she cried and she said, just telling me her life stories, and then finally say that, you know, I have never felt more heard by a nurse. I went to a clinic. I will not mention the clinic. I went to clinic and I met the sister. And because she was late for the vaccination, she was told where to get off. She was told she wasn't going to prioritize. She was going to be last on the list. And if the vaccine was finished, then that's that. She'd have to come another day because she's irresponsible. But if you think about it, instead of moving to she's lazy, she's not responsible, she's a mother. She knows that she has to bring the baby for vaccination. But life happens because we are women. We get caught up in things. Encourage her. Mommy, the importance of doing vaccines timely is 1, 2, 3. And I understand that you had whatever. Commend her for even bringing the baby that day. At least she brought the baby. There are babies that go on without vaccination, you know, because maybe mommy does not have time at all or she just can't make the means. Unfortunately, it happens.
Honestly, and it takes just like a few seconds or minutes to find out exactly what the reason is before making assumptions or drawing conclusions that this is the reason that this happened. And I love what you mentioned about asking this lady how her day was, because clearly her attitude was coming from a place where she was hurt by whatever she was dealing with, but it happened that she lashed out towards you. So I think that's one huge thing that I would love for nurses to take out of this, that we are all people at the end of the day.
Definitely.
We are all human beings.
Definitely.
And like you said, we are carrying so much. And when people look at you at face value, they have absolutely no idea what you're going through. They have no idea what you've come through, like what you've overcome.
Exactly.
So just that little bit of kindness or giving a person that opportunity to at least explain.
You know, and using curiosity over judgment. Ask questions. Then the person will tell you. Open that line of communication.
Oh, thank you for being such a great example to other nurses. Thank you for being so kind, so caring, so compassionate. We need more nurses like you, honestly. And I hope that this episode actually reaches thousands of nurses and that it somehow shifts their mindset with how they've been handling things. And I hope that the next time when we have our part 2, because there's a lot I want to dig into, that we'll be at a point where we can say, you know what, there's a lot of nurses now who are also becoming women building women.
Oh, yes. Oh, yes, definitely. Most definitely.
Yeah. Thank you, Zodwa.
Thank you for having me.
Thank you for making me cry.
Oh, thank you for making me cry.
That is the first time I've cried on my podcast. And my first episode of this season was insane because even when I recorded it, I was in the thick of depression. You can see it on my face. People who know me could see in that episode, what is this one? She's fighting for her life, but not a single tear. Well, shit, I think I was just defeated. Like, I was like, I'm so tired of being so sad. So it was actually my first time crying on the podcast. So I love that. That's going to make us such great content. But yeah, everyone, as I always say, until next time, continue being the woman building women.